will now hand over to Nicola, who hopefully will be online. I'll direct the slides for you, Nicola, if you want to pick up.
That's lovely. Thank you, Jason. Can you hear me?
Perfect.
Okay, excellent. Thank you. Good evening, everyone. So I'm Nicola Windsor, and I'm part of the project management team that is leading the Thurrock Integrated Medical Centres programme for all of the partners in Thurrock, along with my colleagues who are here today from Thurrock Council and Health. So between us, we hope to provide you with a short update on the wider IMC programme and to answer any questions that you may have. The partnership, which includes Basildon Hospital, Thurrock Council, providers of community and mental health and primary care, along obviously with our colleagues from PCRL for Purfleet, are fully committed to the development of 4 integrated medical centres across the borough. This is very much a partnership between Thurrock Council, the NHS and the local community. And we all want to see health and care services delivered closer to where people live in modern buildings with a range of services, delivered by staff with many different health and care disciplines, designed to prevent people needing to go to hospital. So IMCs are all about early intervention and prevention. So we've been working on this programme for a number of years now, and the need for these integrated medical centres has been strengthened, not reduced, by our experience with COVID over the past year. The need for the IMCs has always been including the following. So a lot of our GP practices are under huge pressure, and the population of Thurrock is growing. We know we need to expand the capacity and the quality of primary care services. The new integrated medical centres will mean moving from outdated facilities and services working in silo to specifically designed buildings, delivering a joined up health and social care, community and third sector care approach with Thurrock residents at the heart. So the new Purfleet IMC will be located close to the heart of the new town centre and will primarily serve Purfleet, Aveley and South Ockendon residents. Purfleet residents, though, will also be able to attend other IMCs for appointments, which will hopefully help with patient choice. So the IMCs are for all Thurrock residents in terms of outpatient, diagnostics and blood tests. They will bring together a new primary care offer, social care services such as wellbeing teams and community-led support, alongside technology-enabled care, and relocate a number of outpatient services into the community from Orsett Hospital. So Thurrock Council and the NHS partners, alongside the community and the voluntary sector, remain committed to developing the IMCs to ensure that we deliver state-of-the-art integrated medical centres, ensuring that people can access the majority of what they need close to home, whilst offering a very different joined-up health and care solution. We want to ensure that communities will be involved in seeing the development through to concept designs all the way through to completion. So each community will be offered an opportunity to name the building. We've got lots of different ideas about competitions, local competitions, and also we want to involve schools and young people and offer the chance to come together to create a mural and some art and design for each of the IMCs, which will reflect the importance of their own local community being stronger together and focusing on self-care, emotional health and well-being. So this map shows where the IMCs will be built. They will serve the whole of Thurrock's population, and good progress is being made on the integrated medical centres. There are all, however, progressing at slightly different rates. The first of the 4 IMCs is being built in Corringham and is being funded by Nelft NHS. Building work for this scheme will start this week, and the centre is due to open in spring 2022. Tilbury IMC is being led by Thurrock Council and is at the design stage of the scheme, progressing really well, and should be completed by the winter of 2023. Grays is also being led by Basildon Hospital and EPUT, who own the site at Thurrock Community Hospital. So they are currently reviewing their master plan, and the scheme will restart again in March as the project has had to be paused due to the current pandemic. But Jason will present Purfleet IMC in a bit more detail shortly. So what we have found that it's taken time to build brand new initiatives with many different partner organisations and developers coming together to create this 21st century facility that embody the ethos of providing better care together. And that's our wider transformation programme in Thurrock. As you can imagine, the complexity of this programme cannot be understated. To build one IMC is complicated enough, let alone four. So transport and access are key themes people told us they were concerned about last time we talked to the residents about the IMCs. And this is something we are working closely on with our transport and highways colleagues at the council, along with the design teams for each of them. So here is an indicative schedule of accommodation for each IMC. What I can say is that we are committed to delivering that joined up health, social care, community, third sector approach. It will bring the new primary care offer with new primary care health professionals to better meet the needs of the local population. Alongside primary care, we'll have multi-professional teams providing enhanced services for residents. Additional services will be available in the new IMCs, including blood tests, children and young people's health and care services, mental health and wellbeing support, social care and community-led services. So we hope to attract more people to support the health services. This will include the extended primary care teams currently available to many residents in Thurrock. So this would include physiotherapists, clinical pharmacists, advanced nurse practitioners able to prescribe, and of course these will be GP-led centres. This is all part of the wider strategy for primary care in Thurrock. So we are working on the detail of this model. So this doesn't give everything that we want to provide and how we want to provide it. So we're looking at each community health and care needs so that we can develop and shape how best to deliver services in each of the centres. So once we have shaped this new integrated model, we'd like the opportunity to come back here and review this with you so that you can help us identify any gaps. And we anticipate that we'll be able to share this with you in the next few months. So we're hoping that we will have an invite back here. So I'm going to pass you on now back to Jason, who's going to talk a little bit more about the details around specifically Purfleet IMC and where we are with our roadmap to success. Thank you.
Thanks, Nicola. So in terms of the roadmap for the Purfleet IMC, as Nicola said, we've been working with Nicola and the rest of the CCG and HS team in developing up a concept for the IMC in Purfleet. It ostensibly is going through a process of business case approval with the NHS as we speak. That'll complete in the next few months. And those initial designs are being integrated by the PCRL team to fit in with the rest of the master plan. As we said, by March, we'll have the business development piece, initial business development piece completed. And we think at around the March-April time would be the optimum time to come back and talk through, John, probably through the Purfleet Design Forum on the presentation of the IMC design, so we can get that early input from the local teams. Ultimately, we're all aiming for and will hit a completion of the Purfleet IMC by the end of 2023 in conjunction with a whole lot of the Purfleet Master Plan. And here is the Purfleet Master Plan, the illustrative master plan, and the area in red is what we classify as our town centre. It has the new railway station at the heart of it that sits over the new town, over the railway station, railway line, I should say, and it has a pedestrian bridge both for public and ticketing facilities on either side, so the platform is accessible from all areas. The IMC sits right at the heart of that master plan. You can see it there in red. It is the ground and first floor of a building we called 1B, which is residential above. But as you can see, it takes on a large floor plate directly facing onto the civic square, which is easily accessible directly to the railway station and indeed to the town centre on the other side. It's shown in this drawing, or this image, the 3D image up to the top. It's the area in green. So as I said, it's the ground and first floor, and we have some indicative floor plans that I'll show you in a sec. But in terms of our architectural team, it's AHMM, who are our overall master planners on the scheme. They're also doing the detailed design on the IMC at this point. And this is a couple of precedents that they've used and have been awarded for local medical facilities. This one's in Kentish Town and another one in North London Hospice and West Norwood Health, where similar type of IMC facilities have been provided. And you can see it's all about light, airy space and very open and accessible. Here is the ground floor, the indicative ground floor of the IMC as it stands. And I'll just walk through this very quickly. The blue triangle shows the entry to the facility, the waiting area, fully public. You walk into an open reception, and that's where members of the public would come in and register. They would then wait there and be seen to by GPs who would take them to treatment rooms either on the same floor, you can see those in green, or indeed go up a level through the lifts that are within the IMC, those are shown in grey, to the first floor. I'm sorry, I'll just jump to the first floor, where there's additional consultation and examination rooms. On the first floor, there's also the office areas for the staff of the IMC itself. And then it actually backs onto a central atrium on the 1B building. You can see that behind the lift course. So we are looking at proposals for garden areas and open access to natural light on all areas. If I can just jump back to the first floor, you can see the white areas on this plan are actually, they're the access to the residential above. So the IMC on the ground and first floor as part of an integrated offer to the residential. But very importantly, you can see there on the right in purple, a pharmacy and a dentist facility. And while that's not formally part of the approval through the NHS process we're going through, we're working with the NHS team and we're working with the rest of the Purfleet scheme to bring supporting dentistry and pharmaceutical offers, retail offers like a Boots, for example, so that it's co-located with the IMC as an integrated offer. In terms of the entrance and some early architectural sort of aspirations, Nicola talked about murals and so forth, and these are you can see those on some of these precedent buildings where we are looking to bring that sort of light and playfulness into the architecture. We're not looking to make these IMCs, and particularly the Purfleet one, a sterilised, institutional architecture. These are all about local community facilities, providing local community health, and we want them to be open and accessible in that way. Again, some more images of the type of architectural finishes we're looking at, and then through the floor plates, and these are some other precedent designs.